Okay, dear students, today we will learn about mediastinum. So mediastinum, it is a space between the two pleural cavities. So here in this image, you can see the heart covered by the pericardium in the middle. So on either side we can see the pleura. So this space in the middle, this part is the mediastinum. So the mediastinum in Latin, it means the middle septum. So I said mediastinum is the space between two pleural cavities in thorax, and it is bounded laterally by the pleural cavities. So on each side we can see the pleura. And anteriorly it is related to the sternum. So this is the lateral view of the mediastinum, where we can appreciate anterior and posterior boundaries. So the mediastinum, I said it is in Latin, it is the middle septum, and it is the space between the two pleural cavities in the thorax. It is bounded laterally by the pleural cavities, and anteriorly it is bounded by the sternum. And posteriorly it is bounded by the 12 thoracic vertebra. So posteriorly it is related to the, I'll show in other schematic picture, and it consists of all the viscera and the structures of the thoracic cavity, like we can see the heart in the pericardium, heart within the pericardium, and its great vessels like aorta, pulmonary trunk, superior vena cava, inferior vena cava, which are attached to the aorta, are also present in the mediastinum. And along with these structures, we also see esophagus. This is esophagus, trachea. It consists of esophagus, trachea, principal bronchi, which are the where the trachea terminates into two right and left principal bronchi, and mediastinal lymph nodes, remnants of thymus. So here is the thymus. Remnants of thymus are all present, and some more structures are all present in the mediastinum. So except lungs, rest everything is in the mediastinum. So mediastinum occupies the central compartment of the thoracic cavity. So here it is, it occupies the central compartment of the thoracic cavity, and we can appreciate thymus here, and the great blood vessels which are coming out and going inside the heart, and inferiorly we can see the diaphragm. So this is the mediastinum after removing the sternum and the ribs anteriorly, and we can see it is like a gap between the two lungs and pleura. Okay, let's see the boundaries of the mediastinum. So anteriorly it is bounded by sternum. So here is the schematic image to show the boundaries of the mediastinum. Posteriorly it is related to the vertebral column. So bodies of thoracic vertebra and intervening intervertebral disc. So all these are thoracic vertebrae along with the intervertebral disc, and superiorly superior thoracic aperture. So this opening is the aperture, and inferiorly it is related to diaphragm. So inferiorly it is bounded by the diaphragm. On each side it is related to mediastinal pleura. Let's see the subdivisions. The mediastinum is divided into superior mediastinum. So this pink shaded area is superior mediastinum, and it is related to inferior mediastinum, by an horizontal imaginary line till T4. So this three areas all together is called inferior, inferior mediastinum. So how it is divided, superior and inferior? It is divided by an imaginary transverse thoracic plane which is drawn from the sternal angle of Lewis, that is the junction between the manubrium and body of the sternum at the level of second costal cartilage to T4 to T5. So here we can see, so it is the junction between the manubrium, body of sternum. So it is the junction between the manubrium and body of the sternum at the level of second costal cartilage, and the imaginary line is drawn up till the lower border of T4, that is between T4 and T5. So that's how we divide the mediastinum into superior and inferior. Inferior mediastinum is then further divided into anterior, middle and posterior divisions. So this inferior is further divided into anterior, the orange colored one is the middle, and this one is the posterior. So inferior mediastinum we are further dividing into anterior, middle and posterior divisions by the pericardium enclosing the heart. So we can see the outline of the pericardium enclosing the heart. So the part in front of the pericardium is called as anterior mediastinum. So here this is the anterior mediastinum which is in front of the pericardium, and the part behind the pericardium is considered as posterior mediastinum. So this green color zone is the posterior mediastinum, whereas the part which is enclosed by the pericardium is called as middle mediastinum. So let's have some clinical correlation here. The subdivisions of the mediastinum are well appreciated in the lateral view of the chest X-ray. So these subdivisions are clearly appreciated in the lateral view of chest X-ray. So the shadow above the sternal plane represents the superior mediastinum. The subdivisions of inferior mediastinum are demarcated as cardiac shadow above the anterior part of the diaphragm represents the middle mediastinum. And retrosternal space, it is the space in front of the cardiac shadow, represents the anterior mediastinum. So retrosternal space which is in front of the cardiac shadow, this part is the anterior mediastinum, which is otherwise called as retrosternal space. Retrocardiac space, the space between the cardiac shadow and the shadow of the vertebral column, represents the posterior mediastinum. So this green colored part here, this is the posterior mediastinum, which is called as retrocardiac space. Let's talk about this superior mediastinum little more in detail. Superior mediastinum, we know it lies between the manubrium sterni. So this is manubrium sterni, which is present anteriorly, and posteriorly it is related to upper 4 thoracic vertebra, that is T1, T2, T3 and T4. So upper 4 thoracic vertebra it is related. This superior mediastinum is separated from the inferior mediastinum by imaginary plane. Superiorly it is related to the plane of superior thoracic aperture, and inferiorly by this imaginary plane. So here is the image exposing the superior mediastinum by removing the pericardium, heart and sternum and all the anterior part of the ribs and costal cartilages. All these are removed, even the clavicles, all are removed to expose the superior mediastinum. So contents of the superior mediastinum, it has got the aortic arch, and upper half of the superior vena cava, and it is containing the trachea, esophagus, thoracic duct. So here is the trachea, and esophagus is little behind the trachea. We see the lower part of the esophagus. Thoracic duct. So this green colored beaded structure is the thoracic duct, and thymic remnants, the remnants of thymus, are the contents, and also it contains brachiocephalic trunk which drains into superior vena cava. And it is related to the thoracic portions of the left common carotid artery. So here is the schematic picture where we can understand the contents of the superior mediastinum. So we can see the arch of aorta here. This is the arch of aorta, and upper half of superior vena cava. Here is the superior vena cava, and we can also appreciate the thoracic duct, which is not shown here. Previously I had shown the thoracic duct, thymic remnants, brachiocephalic trunk. So this is the which is a branch of arch of aorta, brachiocephalic trunk, left highest intercostal veins, vagus, cardiac, phrenic nerves. So we can see the cardiac and phrenic nerves, and we can also appreciate the left recurrent laryngeal nerve, and the lymph nodes, lower ends of sternohyoid, sternothyroid, longus coli. So all these structures, this is an anterior view where we can expose the structures of the superior mediastinum. Same structures we can see in the transverse section also. So here is the transverse section which is taken at the level, the cross section which is taken at the level of superior mediastinum, and here we can appreciate the structures. This is sternum. So here is the anterior part because sternum is present. This is thoracic vertebra which is between T2 to T3 because it is taken in the superior mediastinum, and the structures which we can see here are superior vena cava. We can even appreciate trachea. Arch of aorta is not seen because it is taken at a higher section. So we can see the three branches from the arch of aorta: left common carotid artery and left subclavian artery. And this is brachiocephalic trunk. And we can even appreciate remnants of thymus. This is brachiocephalic vein draining into superior vena cava. And we can even appreciate the muscles, that is sternohyoid, sternothyroid and longus coli. So we can see here these two are sternohyoid and and we can even appreciate esophagus, thoracic duct, and we can appreciate nerves. So this is the left side. So we can appreciate left side, left recurrent laryngeal nerve, left recurrent laryngeal, left phrenic nerve, and on the right side this is the right vagus, right phrenic. So these are the structures which are present in the superior mediastinum. So here is the image of the mediastinum exposed after removing the left lung. So this is from the left view where we can see the arch of aorta from the left side. So now we would discuss about the inferior mediastinum, and we knew that the inferior mediastinum is divided into three parts, that is the anterior, which is in front of the pericardium, middle containing the pericardium and its contents, that is this one is the middle mediastinum, anterior is here, and this is the posterior mediastinum. So posterior mediastinum is present behind the pericardium, that is posterior to the pericardium. So talking about the anterior mediastinum is bounded anteriorly by sternum. So anteriorly we can see the sternum, and anterior mediastinum, it is bounded anteriorly by the sternum and also the transversus thoracis muscle, which is present in the anterior side, and 5th to 7th left costal cartilages. So if you see, it is related to 5th to. So these are the structures related anteriorly in the anterior mediastinum, and if you see, and posteriorly anterior mediastinum is bounded by the pericardium. So we can see this is the pericardium containing the heart. So anterior mediastinum contains the thymus. This is the thymus in the anterior mediastinum. We can see the thymus present anterior to the great vessels and the pericardium, and it also contains the small mediastinal branches of internal thoracic artery. So these are the mediastinal branches. The red ones are the arteries. And it also contains the lymphatic vessels and lymph nodes, and even the veins draining into internal thoracic veins, mediastinal veins draining into the internal thoracic veins, and it also contains the lymphatic vessels, lymph nodes in the anterior mediastinum. So let's move on to the middle mediastinum. Middle mediastinum contains heart. So here the pericardium is removed to expose the heart in this particular image. So the middle mediastinum contains heart enclosed in the pericardium. So this reflected one is pericardium, and the ascending aorta, the lower half of the superior vena cava receiving the azygous venous arch are present. So this is ascending aorta, lower half of superior vena cava are present, and here at this point it receives the azygous venous arch posteriorly, and we can also appreciate bifurcation of trachea. So in this image we can see the bifurcation of trachea, and we can see the arch of aorta is cut to expose the bifurcation of trachea here. So the bifurcation of the trachea into right and left principal bronchi, the pulmonary artery dividing into two branches. So we can see the pulmonary, cut parts of pulmonary arteries, right and left pulmonary trunks. So we can see here the bifurcation of the trachea in this particular image into right and left principal bronchi, the pulmonary artery dividing into two branches, right and left pulmonary trunks, and we can also appreciate the phrenic nerves, these nerves here. Phrenic nerve are also extending into posterior mediastinum. So right and left phrenic nerves, the deep part of cardiac plexus, and tracheobronchial lymph nodes. So apart from this deep part of cardiac plexus, we can see the plexus here, which are formed from the vagus, and tracheobronchial lymph nodes, and short thoracic part of inferior vena cava. So here we can see this is inferior vena cava before opening into the right atrium of heart. So these are the structures present in the middle mediastinum. So here is a schematic image again to show the contents of middle mediastinum. So we can see the green dotted structure is the pericardium, which encloses the heart, and also the great vessels before their origin and termination. So we can see the pulmonary trunk dividing into right and left pulmonary arteries, lower part of superior vena cava, termination of azygos vein, and we can also appreciate ascending aorta, and from down inferior vena cava. So these are the structures which can be appreciated in this schematic view. And also the middle mediastinum, we can see the pulmonary veins on each side, right and left pulmonary veins opening into the left atrium of heart. So let's talk about the posterior mediastinum. So we are left out with only posterior mediastinum, but posterior mediastinum is very important because many contents are there in the posterior mediastinum. Posterior mediastinum, it is bounded anteriorly by the pericardium. So the green shaded area is the posterior mediastinum. So this is the posterior mediastinum, where we can appreciate anteriorly the pericardium, and above the posterior, and it lies to the posterior surface of the diaphragm inferiorly. So inferiorly it is related to the diaphragm, and posteriorly from 5th to 12th thoracic vertebra. So from T5 to T12, so T6, T8, T9, T10, T11. So from 5th to T12 along with the intervening intervertebral disc, and superiorly the imaginary plane separating it from the superior mediastinum. So these are the boundaries of posterior mediastinum. Let's see the contents of the posterior mediastinum. So after removing the heart and pericardium in this particular image, even the arch of aorta is cut, pulmonary trunk is cut, all these structures are cut to expose the posterior mediastinum. So posterior mediastinum contains descending thoracic aorta. So we can appreciate very well here. So descending thoracic aorta on the left side of the spine, and the esophagus, the median but positioned anterior to the aorta. So here is the esophagus, esophagus, descending aorta. Then it is also related to more posteriorly the azygos, hemiazygos veins. So we can see azygos here, and hemiazygos opening we can see. So termination of hemiazygos can also be appreciated here, and thoracic duct lymph nodes. So this green beaded structure, thoracic duct, and we can also appreciate some lymph nodes. Here in this image can't be seen, but lymph nodes are also present. Right and left sympathetic chains. So one side sympathetic chain is clear just next to the azygos vein. So next to the sympathetic chain, it also contains thoracic splanchnic nerves. So we can see these thin nerves. So these are the contents of the posterior mediastinum. So here is the schematic image showing the contents of the posterior mediastinum. So we can see the descending thoracic aorta. We can see esophagus. We can also appreciate mediastinal lymph nodes. And we can see azygous vein. Along with the azygous, thoracic duct and termination of hemiazygous and accessory hemiazygous can also be appreciated. So this is a schematic image to show the structures of posterior mediastinum. So this completes about the mediastinum, different parts of mediastinum and their boundaries and contents of each part of mediastinum. So after completing the divisions of mediastinum, we will move on to clinical aspect associated with mediastinum. The first and foremost condition is mediastinitis, that is the inflammation of loose connective tissue of the mediastinum is called as mediastinitis. The infection spreads readily to the facial spaces and there are tissue spaces which are the potential spaces that exist between the fascia of the neck. For example, we know retropharyngeal space, parapharyngeal space, pretracheal space. So, and these are from some potential facial spaces where infection can infiltrate very easily. So, the deep infections spreads easily into the mediastinum via these potential facial spaces. Let's talk about thoracic outlet syndrome. So, thoracic outlet syndrome, we know the superior thoracic aperture, which is also known as thoracic inlet, and some authors consider it as thoracic outlet. It is bounded by the manubrium anteriorly. So, here is manubrium, and on each side it is bounded by the first rib. So, laterally it is bounded by the first rib, and it is also related to first thoracic vertebra posteriorly. So, this is T1, first thoracic vertebra. So, these are the boundaries of thoracic outlet or thoracic inlet. So, if the structures passing through the superior thoracic aperture are compressed, it causes thoracic outlet syndrome. So, the structures passing through the superior thoracic aperture are, we will talk about the muscles first. The muscles are sternohyoid, which gets origin from the sternum and runs upwards towards the hyoid, called as sternothyroid, longus cervicis or longus colli, and arteries are right and left internal thoracic arteries. Internal thoracic artery, I am writing short form. Brachiocephalic trunk or brachiocephalic artery. Then the structures passing through the superior thoracic aperture are like left common carotid artery, left subclavian artery, and right and left superior intercostal arteries, right and left superior intercostal arteries, and the nerves are right and left vagus and vagus nerves, and left recurrent laryngeal nerve, right and left phrenic nerves. Recurrent laryngeal nerve, right and left phrenic nerves. So these are the contents passing near the superior thoracic aperture. And also along with these nerves, we also have sympathetic chains also, right and left. This list forms the contents. And veins, we have got right and left brachiocephalic veins, right and left first posterior intercostal veins, inferior thyroid veins, and we also have got lymphatics like thoracic duct and viscera like apices of the lungs, cervical pleura, trachea, esophagus, and also the anterior longitudinal ligament. So all these structures are present in the thoracic inlet. So thoracic outlet syndrome means it is the compression of these neurovascular structures such as the subclavian artery or brachial plexus, that is the lower trunk of C8 and T1, or it may be because of less often axillary vein or subclavian vein by thoracic outlet abnormalities, or drooping of the shoulder girdle, or extra rib in the neck called as the cervical rib, or due to the fibrous band present in the cervical region, or it may be due to abnormal first rib, or occasionally compression of edge of the scalene anterior muscle, which is called as scalenus syndrome. So all these structures may compress the arterial or nerves which are present in the thoracic inlet. Arterial compressions leads to ischemia, paresthesia, numbness, and weakness of the affected arm. Nerve compression causes atrophy or the weakness of the muscles of the hand because the brachial plexus is getting compressed here, and in advanced cases like forearm with pain and sensory disturbances in the arm may also be associated because of the compression of brachial plexus. So this completes the thoracic outlet syndrome, which is also called as thoracic inlet. So we completed with the mediastinum. Thank you.